New Mexico has one of the highest rates of syphilis transmission in the country, and now the state's Department of Health is raising the alarm. News 13's Natalie Waters spoke with the state's Secretary of Health about this distressing trend and what they're now directing doctors to do.
Increases have been dramatic. In the 90s, we were looking at syphilis eradication in the United States, and then all of a sudden it started to make a comeback, kind of flying under the radar for a while.
Syphilis is on the rise in New Mexico.
I think people just didn't catch fast enough that the cases were going up. In the last 5 years, the numbers have really exploded.
So much so, the state's health department is sounding the alarm to healthcare providers.
We've renewed a public health order that's been in place since 2020 that's oriented toward trying to tamp down the amount of syphilis that's going on in the state.
He ranks New Mexico as having the highest rate of congenital syphilis, meaning it's passed from mother to infant during birth, and the second highest rate of syphilis infection generally in the nation.
If left untreated, can have lots of long-term health effects.
Last year, there were 91 cases in New Mexico of congenital syphilis, leading to the death of 17 babies, 16 of them in the womb. Congenital syphilis can cause serious birth defects, miscarriage, and infant death.
It's a tragedy because it's 100% preventable.
This represents a 20% increase in congenital syphilis from 2022 to 2023. And 9 times more than 5 years earlier. The trend is similar nationwide.
And that's what the public health order is really about, is increasing significantly the amount of testing that we do.
The public health order directs medical professionals to do more testing of people between 18 and 50 for the disease within the next 12 months. More testing of pregnant people at multiple stages during the pregnancy, and testing of pregnant inmates.
The populations that seem to have the most concentration of this are people who are homeless and people who are in correctional settings.
The secretary says while serious, syphilis is preventable.
This is something that you should get tested for. Everyone should get tested at least once for it, and particularly people who are pregnant should get those 3 tests during pregnancy to make sure that we don't have the 16 deaths that we had last year going forward.
Natalie Waters, KRQE News 13.
That public health order went into effect Thursday. It lasts for 1 year.